dome and transverse liver hepatics. So in long, you're going to come, where was that pretty liver? There it is. You're going to aim the transducer all the way up towards the right armpit. And it's just going to be liver.
Okay.
It's not correct if you have all these vessels or the gallbladder. Here's gallbladder.
Mm-hmm.
You have to aim. You're going to heel the transducer. I want to see the whole diaphragm as high up as you can. Focus is at the bottom. This is artifact we'll talk about at another time. Sometimes if you have your patient breathe in, I really like this picture. I'll get it in a minute. So this is long right liver. So up here, oh, I hate when that happens.
Yeah.
What's over here?
Inferior.
I believe I used to type for a living.
Yeah, touch screen posterior.
And
Superior.
this
Diaphragm.
echogenic line is the diaphragm. P-H.
GM. P-I-A-P-H-R-A-G.
R-A-G-M.
Yep.
And
Right lobe of liver.
liver.
Should we write down just liver or right lobe?
Liver's fine. You got right,
Okay.
long right liver up there.
Okay.
Okay. So, oh man,
Ah.
I hate when that
Now
happens.
here, this thing is a perfect liver.
All right, store it.
Okay.
Okay. Now let me get rid of text here. So what happens too is you can have your patient take a deep breath in. You got your eye here on the diaphragm. Okay, see how I have vessels and things in here? I don't like that. I have to aim more lateral and towards her shoulder. Okay, so you're laying the transducer down a little bit. You can also get the same picture in transverse, but you're laying the, take a breath in. But we're not going to get it in both. We're just going to get it in long, but it would be the same in trans. Okay, so it really looks the same. So in trans, this is where you're going to start. If you'll go to the dome and then start raising the cord part of the transducer to the ceiling, look what pops in.
Hepatics.
The hepatics. So I should have had Desiree take that picture. Okay. In case we can't get a better one. There we go.
When is this one due? Not next week, the week after.
What is your data? This one's at 13. So I want a little bit, I don't want the diaphragm sitting on the bottom of the picture. I want to be able to see on the other side. Because on this side of the diaphragm is lung. And if somebody has fluid around their lungs, it's going to show up on this side of the diaphragm. So that would be called a pleural effusion. So this is trans liver hepatics. And we have right liver. We have diaphragm. pH. We have IVC. And we have,
Right
we're
hepatic.
going to call this one right. Hepatic.
Middle.
Middle hepatic. And if you get the left one, you can label it. If you're not sure if they're middle or left or right, just call it a hepatic.
And we can say portal also or no?
This is a portal
Oh, yeah,
vein right
portal,
there.
okay.
Okay? Save that. And whoops, we forgot to measure anterior. What's over here?
Inferior.
Mhm.
Oh, patient left, sorry. We are trans. It's not center.
Well, yeah. This is
First division.
and okay. So that's the picture.
Please.
On next quarter, when you're getting your pictures, you're not going to label your images like you do this quarter. This is just for you to learn your anatomy. You never want to label over anatomy in the real world because you could be covering something up. Okay? Did I store that? I will again, just in case. Oops. Okay, aiming up towards her right shoulder, bringing the tail of the transducer up, and there's hepatics. If we bring the tail of the transducer up some more, there's your portal vein. Okay, so there's hepatic and then portal. And her tiny little gallbladder right there.
There's just two images for this.
Just two.
assignment.
The dome, like that, way up high, aiming lateral and towards, and healing the transducer towards her armpit, and then transfers. Okay?
Two to one.
2 pictures on each machine.